Frustration is growing at the slow international response to the fight against the disease.
We're joined now by Andy Gleadle from the International Medical Corps, just returned from Sierra Leone. Very good morning to you.
Morning.
When you say just returned, how recently have you come back?
I just got in Thursday evening.
OK, so you have direct first-hand experience. Tell us a little about what the situation on the ground is now.
Well, as you said, it's a terrible situation. The virus is raging out of control. We're seeing hundreds, maybe thousands of new cases every week.
There you go. 10 minutes past 9 is the time.
We're going to get the weather with Chris in a few moments. First, no, let's go back to the Ebola outbreak in West Africa. Frustration is growing at the slow international response to the fight against the disease.
We're joined now by Andy Gleadle from the International Medical Corps, just returned from Sierra Leone. Very good morning to you.
Morning.
When you say just returned, how recently have you come back?
I just got in Thursday evening.
OK, so you have direct first-hand experience. Tell us a little about what the situation on the ground is now.
Well, as you said, it's a terrible situation. The virus is raging out of control. We're seeing hundreds, maybe thousands of new cases every week. We're doing the best that we can. Organisations like my own International Medical Corps, putting doctors and nurses on the ground, building treatment centres. But we're running to catch up, and the world really needs to wake up and see this for what it is, which is a massive public health disaster.
Yeah, this is a message we've been talking about. Bishop Stephen Lowe, who's been doing the newspaper reviews, was lamenting that places like China, the United States, investing in Africa, but not acknowledging the problem like this. David Cameron is urging EU leaders to step up and help with funding.
Yes.
What kind of figures are we talking about? And why do you think there's almost been a lackadaisical response?
I think, well, in terms of figures, investment going in from UK is about 100 million so far, but we're seeing over 10,000 people on the ground already affected. 5,000 of those have died. We're trying to put in place an integrated response, but Sierra Leone and Liberia are countries that already faced a lot of underlying challenges to their health system and so on. The whole health infrastructure has collapsed. So not only are we facing an Ebola outbreak, but anyone that presents at a health facility with any kind of disease or illness is not receiving assistance. It's only contracted through body fluids. It's not transmitted through the air, as some people have been saying. So, of course, it's affecting close family groups, men and women living in normal relationships. It can be breastfeeding mothers can pass it to their children. And another very high cause of transmission is when people are actually burying their dead. Touching of dead bodies and so on, it is causing a lot of spread of the disease.
Can you give us a sense of from your work there, how can you stop that cycle of you're talking about small family groups? So you're in a home, and we know there could be many people in one building at one time. What's the key to stopping it passing from one person to a family group? Because there has been a reluctance, as I understand it, for people to present themselves, even if they know they're feeling ill, for fear that they'll go to a place and then contract something.
Yes, exactly. And in the early days, going back 2 or 3 months, people were seeking help at health facilities, but the staff weren't adequately trained. They didn't have protective equipment. And so the health centres themselves became crucibles for exchange of the virus, and many people getting sick. And that knowledge, of course, spread through the communities, so they're unwilling to come and seek assistance. And at the household level, what we're trying to do is educate people, make them aware that by social distancing, by not being in close proximity to one another, they're not going to catch the virus. And what we need to do is break that chain of contamination by educating people at the local level. We're following the World Health Organization's 3-pillared approach, which is to put in health facilities that can treat the sick. It's to do education at the local and village level. It's to conduct proper burials, as I've described, in a safe and effective manner. And we need a lot more lab testing in there so that we can verify who actually has Ebola from those that don't, so that we can separate the infected from the non-infected.
I want to get back to the money issue and why people are perhaps not donating as much, or perhaps not recognising how big this problem is. And I know you've been talking to governments about how their strategy and how they're going to organise the money. Is there anything they can do to show that the money will be well spent? Because that's often something that people are reluctant, find frustrating when they donate. Yes,
I think the money needs to come through the established international organisations, the big international charities like ourselves and other British agencies. We've got 30 years of experience. We've responded to 70 major emergencies around the world. We know what we're doing. We're massively audited by UK government and other donors in more peaceful times, in slower time. If people give money, I give a guarantee it will be effectively used. You know, these are not highly complex operations we're putting in place. We're putting up temporary structures. We're deploying nurses and doctors from the UK health system and the United States of America. We're giving direct care, supportive care to people that are affected by it. The money is well utilised and it is monitored by the UN system, by the government system. The challenge that we face is that many organisations that do specialise in this care are already reaching capacity of what they can do. There's only so many doctors and nurses that are currently trained in the world who can actually give this type of direct care. And the other massive challenge is the lack of availability of what we call PPE, personal protective equipment. You can't go in to a patient care environment and actually care for a sick child or a sick person without wearing all of this high-level protective gear, and it's very, very expensive.
Andy, thank you very much for coming in and talking to us on Breakfast. Andy Gleadle, thank you.
Well, resources and people continue to flood into West Africa to tackle the Ebola outbreak, but the needs here are enormous. Let's get a sense of them from Hussein Ibrahim from the International Medical Corps UK. To run one of your Ebola treatment centres is enormously expensive. Just give us a sense of that.
It is expensive. We're looking at a monthly cost of about £800,000 just to run that. And the cost for getting personal protection suit is exorbitant because we're averaging 30,000 for a 6-month period.
30,000 suits?
30,000 suit, yes.
That's an enormous number. And chlorine as well?
Massive amounts needed. We're averaging about 80 to 100 kilograms a day.
That combined with the water, the fuel, the generators, it's massive. And as well as money, you need people, don't you?
We do need people. To run a 100-bed ETC, we're looking at 250 staff to run that on a 6-week rotation. So yes, we do need a lot of people, volunteers, and we do need donations as well from the private sectors to help us in the fight against this disease.
If nurses are watching, you want them to volunteer. It's a big commitment.
Please, I would ask that they do.
And what, it's a 6-week rotation here?
6 weeks rotations, yes.
Working in some very tough conditions?
Working in very, very tough conditions. As you see, it's quite hot here, and imagine with the personal protective equipment you have in, suits that you have in, it's a great undertaking.